And I cannot ethically work for a company and by association for a government that is going to create a two-tier system for patient care. I mean, equitable access of care has been a cornerstone of Canadian healthcare. Like, this was drilled into us in school over and over and over again. How do we reach marginalized populations? All this kind of stuff. And now the system itself is creating its own barrier. And I can't ethically participate in that. The second issue that drove me to say, no, I'm not going back to work for AHS was the issue of informed consent. Informed consent explicitly states that there cannot be any coercion or duress placed upon the patient, because that's usually who they're referring to, when they are making their decision for informed consent, whether that be for surgery or a medication they're going to take, etc. There must not be any coercion or duress. I'm sorry, but threatening my job is coercion and distress. Therefore, AHS cannot justifiably say that their nurses or their healthcare professionals, doctors, whomever, have taken this vaccine in recent months under informed consent, because all of our jobs have been on the line.
Warning, censorship. Warning, censorship.
As of October 31st, Halloween 2021, Alberta Health Services will require all employees and contracted healthcare providers, including physicians and other frontline healthcare workers, to be fully immunized against COVID-19, or these workers will be placed on unpaid leave, which of course amounts to constructive dismissal. I mean, how long can you at home sit there not working, not getting paid? Now, according to Alberta Health Services' own website, the latest an employee could receive their second dose of COVID vaccine to be in compliance with the new policy is October 16th, 2021, which allows for 2 weeks that must pass to be considered fully immunized. Now, Dr. Verna Yu, she's the president and CEO of Alberta Health Services, says this is all necessary to help her maintain a safe environment for all patients and clients. But what does this forced vaccination policy mean in practice when a nurse questions the ethics of forced vaccinations? Well, you're about to meet a young nurse named Julianne who, as you are about to hear, resigned her position rather than go to work for a morally compromised organization. Here.
I've worked as a registered nurse in various hospitals in Alberta, ranging from Rocky Mountain House, St. Paul, also even further north in Alberta. And my first passion is mission nursing, actually, but here in Alberta, I've been rural ER for most of my career, while dabbling in other things like labor and delivery and other stuff like that.
So I'm just going to take away that, you went into nursing because you want to help people. I mean, based on the fact that your real passion is mission nursing.
Yeah, absolutely. When I was a teenager, my parents took us to Africa, and I always say it was the most expensive bug they could have ever given us, because now a lot of us kids actually travel internationally to do mission work, and we just fell in love with it. There's nothing like it.
Now, you have made a recent decision to resign your position as a nurse, something you are very clearly passionate about. But before we get to that, you were working during the pandemic in Alberta hospitals safely, right?
Yep.
So
everybody was. AHS implemented very stringent PPE protocols, etc. And yes, I did not work the duration of the pandemic. I worked from December of 2020 until April of 2021. And we were able to work safely with the PPE protocols in place.
Now, as a nurse, what other vaccination requirements have been placed on you outside of COVID-19?
That is a brilliant question, and I am
Thank you.
so glad that you asked that question. So in Alberta, there's this fascinating rule that healthcare workers must be immunized against rubella. And ironically, that actually doesn't mean that you have to be vaccinated against rubella. You have to be able to prove via a blood test that you have a certain amount of antibodies to the rubella disease. And if you can prove immunity, say somebody had it as a child, that is acceptable to Alberta Health Services. So by law, rubella is the only immunization that a healthcare worker is required to have.
And you are able to prove that through an antibody test. And yet with COVID-19, it's been my experience, at least anecdotally through people I've had contact with, that the Alberta government is really sort of declining to test anybody for antibodies. That if you or your family doctor orders an antibody test to prove that you have been exposed to and now have immunity to COVID-19, the labs just aren't doing them.
Yeah, it's pretty tricky. It's pretty tricky. You can get it through private testers, but it does not seem to be something that AHS is interested in. That's a valid reflection.
And in the past, so with the seasonal flu, nurses are not required to get that vaccine either, right?
No, and that's actually a really common misconception. It has never been mandated that you get the influenza vaccine yearly. There have been some rules put in place that if your unit that you work on is on influenza outbreak and you are unvaccinated, that you may be placed somewhere else that is not on outbreak, but it has never been a condition of employment.
But now all of a sudden, the COVID-19 vaccination is a condition of employment for anybody, I guess, who works for Alberta Health Services. At Rebel News, we're helping even IT workers who've worked from home since March 2020. They are suddenly forced to get the COVID-19 vaccination. You made the decision that you were going to resign instead of be mandated to take this vaccine. Why did you do that?
That is another excellent question. I strongly believe that this is about a lot more than a vaccine. I strongly believe that this is an ethical problem. This is an ethical travesty that is being committed, and that it is very soon going to affect patient care and patient access to the system. We're already seeing patients being denied to be put on the transplant list if they don't have this vaccine. I'm hearing anecdotal stories of women being kicked out of their GP, not their GP, their OBGYN's practice for refusing the vaccine while they're pregnant. This is the type of thing that AHS is tolerating and in some cases instigating. And I cannot ethically work for a company and by association for a government that is going to create a two-tier system for patient care. I mean, equitable access of care has been a cornerstone of Canadian healthcare. Like, this was drilled into us in school over and over and over again. And how do we reach marginalized populations? All this kind of stuff. And now the system itself is creating its own barrier. And I can't ethically participate in that. The second issue that drove me to say, no, I'm not going back to work for AHS was the issue of informed consent. Informed consent explicitly states that there cannot be any coercion or duress placed upon the patient, because that's usually who they're referring to, when they are making their decision for informed consent, whether that be for surgery or a medication they're going to take, etc. There must not be any coercion or duress. I'm sorry, but threatening my job is coercion and distress. Therefore, AHS cannot justifiably say that their nurses or their healthcare professionals, doctors, whomever, have taken this vaccine in recent months under informed consent, because all of our jobs have been on the line for it. So yeah, I can't work for a company who is going to totally violate and flagrantly violate informed consent.
And because you do work for AHS, I'm assuming you're a member of a union?
Correct.
And what has the union done to defend your rights?
The union has taken AHS's stance and said that this is the best policy. Actually, at the beginning, they said this isn't a union issue. This is like a health issue. So we're just not going to get involved. That was UNIT's position.
Sorry to interrupt you, but in the past, the union has intervened when AHS thought that maybe they could mandate you girls into getting the flu vaccine. Your union has stepped in and said, no, you can't do that. But they are siding with the employer this time around.
100%. 100%. Yeah. And it makes it challenging because when you're represented by a union, you cannot seek outside legal support. So a nurse literally has to wait until AHS escorts them out before they can seek any legal help.
What a shame. And those unions are still taking your union dues every single month. And when you need them, where are they?
Yeah, it's really shocking, actually. It's very shocking that they would so disregard a significant portion of their workforce. I mean, there's over 1,000 nurses who have signed a letter requesting the AHS rescind this mandate, and UNA does not care.
Now, what happens for you next? What do you do? Where do you go? What happens to this young lady with a very obvious passion for nursing and cares deeply about patient care and patient care in rural Alberta, something I care about? What happens to you now that the Alberta healthcare system has lost somebody with your talents?
That's very gracious of you. There's so much space for healthcare workers to practice outside of AHS. And I just want to really encourage other healthcare workers who are in this position that we don't have to be stuck in this mentality that we can only work for AHS. There's so many other options. I'm currently doing private hospice care, which is a wide open door. Nurses are allowed to work privately. Physicians are allowed to work privately. LPNs are even allowed to work privately. So I would just really encourage any healthcare professional out there, you can go and basically chart your own course. There's doors that are going to open that we have no idea.
Now, Julianne, before we wrap up the interview, I want to give you an opportunity to speak directly to the bureaucrats and the politicians who are making these decisions that are ultimately forcing good nurses out of the system. If you had one thing that you could say to them, what would it be?
I would say that it is blatantly unfair that they have told the public that we are facing an unprecedented crisis, requiring them to import military nurses to our communities, necessitating lockdown measures, necessitating vaccine passports, and at the same time being not only willing, but enforcing a rule that will literally kick out thousands of healthcare professionals from that same system. That is so hypocritical. I cannot even believe that I'm experiencing that type of hypocrisy from a so-called conservative government.
Now, I'm so glad that Julianne found gratifying work providing end-of-life care. It's so important, but it's also sad and angering that she was put in this position in the first place. And as a customer of Alberta Health Services, as all Albertans are, we shouldn't be okay with pushing out Alberta's best and brightest right out of the healthcare system. For Rebel News, I'm Sheila Gunn-Reid. Julianne resigned her position as a nurse, but she has found new employment providing end-of-life care. But there are many other people still within the healthcare system fighting these vaccine requirements to go to work. If you'd like to help us, help them by taking 20 strategic legal cases all across the country. Please donate today at fightvaccinepassports.com, and all donations there now qualify for a charitable tax receipt through the registered Canadian charity, the Democracy Fund. Again, that special website to donate is fightvaccinepassports.com.